If you're suffering with hip popping when you're doing certain movements or it happens repetitively, a lot of people wonder what the best thing to do is. In fact, many people will search on YouTube to find some exercises to treat it. But is exercise really the best way to treat hip popping? This is our experiment that we're doing today. So our lovely front desk concierge, Erin, has some hip popping. And so we are going to test exercise versus Stimpod versus Shockwave versus dry needling. Now, to be fair, we did the first 3 last week. So we did the exercise first. You'll see the results in just a second. Then Stimpod, then Shockwave. Now, it's a week later, so we're going to have her repeat her movement that causes the popping. And the first thing we're going to do is see if there's been any improvement since last week. Because you see, Stimpod and Shockwave don't necessarily work right away. You don't necessarily get that feedback right away. So we're going to see if there's been any change since last week, and then we're going to finish up with the dry needling today. All right, so here she goes. Okay, so that is going to be your 10. Okay, so Erin has completed her exercise, and now here we go again. Okay, so now 10 was the last time. So on a scale of 0 to 10, where would you say that is compared to just after you did the exercise?
Maybe like a 9. It's just ever so slightly.
Okay, so it's a 9. It's a little bit better, but not too much. All right, Stimpod's up next. Okay, so now we tried some Stimpod on Erin, and here she goes. Okay, so what would you rate that? 10 was the first one.
I think it's probably still at about a 9. It's at the same spot as before.
Same spot as it was before. Okay, off to Shockwave. This is the final one. We just did Shockwave for Miss Erin. Let's see how it feels. Okay, on a scale of 0 to 10, 10 was the first one. What would you say is the intensity now?
Probably, I think an 8.
An 8.
I think it's down at an 8.
Okay,
yeah.
So which, between exercise, Stimpod, and Shockwave, which one would you say is the most effective for you?
I think it probably was the Shockwave. I could just physically feel like when I'm walking how much looser my hip is. And it was easier to get through the pop.
Okay. More fluid, would you say?
Yes.
Okay. Okay, more fluid. Okay, excellent. So what we will do is we're going to give Erin a couple days to recover from all of this, and then we're going to try it. But this time we're going to try dry needling. See you soon. Okay, so for a refresher, Erin, what you did last time at the first point was a 10. So now this is the first one for the second day. So now this is a week after the last filming we did. But I want to still use that as a 10. So that's still the 10. Where are we starting with today?
Okay.
All righty.
Maybe like an 8.5.
Okay.
Yeah.
Which is kind of where we finished as maybe an 8 last time. So a lot of that was maintained. Okay. Then my guess is that that's probably the Shockwave. But okay, we're going to go try some dry needling. See you guys on the backside. Okay, so we just finished dry needling psoas. We did proximal and distal psoas with the dry needling. And
like 6.5, 7.
okay. So
good.
Do you feel like, which one do you feel like had the greatest impact?
I think probably the dry needling.
Okay. More than the Shockwave?
Yeah, more immediate impact anyway.
Okay. And maybe Shockwave was more the long-term impact.
I think so, yeah.
Yeah. Okay. Let's go sum it up. Okay, so what we did there is tested exercise versus Stimpod versus Shockwave versus dry needling. Now, dry needling is the only one that we actually did today, but the other 3 were done a week ago. So Erin feels like the dry needling had the biggest impact initially, like in the moment, and the Shockwave had the most impact from what we can see right now in the long term. Obviously, can't see the impact of dry needling a week from now, right now. But notice, even with all of those, her pain was still about a 6, 6.5. So her pain had not pain. She didn't have pain. She had a popping sensation. That's what she was qualifying, was what that popping sensation was. So it's not painful. It's that popping sensation she still reported was at a 6. So then you might be thinking, okay, well, yeah, see, this is the problem. Like, nothing actually helps it. Here's the thing that is important to know. What is causing the popping for Erin? And my guess would be that this is true for you too. So the psoas is too tight, and that is what is popping over and causing that joint noise. Now, your popping may be painful. I understand. Some people do have painful popping. Luckily, Erin's not there yet, and we're not going to let her get there. But it still didn't get 100% resolved. And what is the reason behind that? Well, I did an evaluation of Erin. It was quite some time ago, which is why I feel like this experiment was still safe today, because it's been a while since we did it. But the truth of the matter is that she has a pelvic malalignment. And that pelvic malalignment may have caused the psoas popping in the first place, or that pelvic malalignment may be causing the psoas malalignment in the first place. So it's a little hard to tell from this far out, chicken and an egg, who started who. But the pelvic malalignment is definitely in conjunction with a tight psoas. So tight psoas causing hip popping, pelvic malalignment causing psoas to be in the wrong position. So can you see that these 2 things are working together? And as you can see from this experiment, you have to deal with both of them. If you don't deal with the pelvic malalignment, then no matter what you do to the psoas, even if you dry needle it and allow it to actually relax, it's not going to lead to the long-term changes that you are looking for. All right, I hope you enjoyed our little experiment here today. If you found it helpful to understand how different treatments work, then drop a comment below and let me know what problem you'd like to see next.